Environmental hazards and healthcare are deeply interconnected, shaping patterns of disease, disability, and death across the world in ways that are often underestimated, unevenly distributed, and preventable. Environmental hazards refer to physical, chemical, and biological factors external to a person that can negatively affect health. These hazards arise from the air people breathe, the water they drink, the food they eat, the soil they live on, the workplaces they occupy, and the broader climate systems that regulate ecosystems and human survival. From a healthcare perspective, environmental hazards are not distant or abstract concerns. They are everyday drivers of hospital admissions, chronic illness, rising healthcare costs, lost productivity, and premature death. They also magnify health inequities, disproportionately affecting children, pregnant women, the elderly, low-income populations, and communities with limited access to quality healthcare. Globally, environmental hazards are responsible for a substantial share of the total burden of disease. Estimates consistently show that roughly 1/4 of all global deaths are linked to modifiable environmental risk factors. This translates into tens of millions of lives lost each year from conditions that are largely preventable through policy, technology, and behavior change. According to assessments by World Health Organization, unhealthy environments contribute to diseases such as stroke, ischemic heart disease, chronic obstructive pulmonary disease, lung cancer, childhood respiratory infections, diarrheal diseases, and certain neurodevelopmental disorders. These conditions account for a large proportion of healthcare utilization worldwide, placing enormous strain on already stretched health systems, especially in low- and middle-income countries. Air pollution stands out as one of the most significant environmental hazards affecting health globally. It exists in two main forms: ambient or outdoor air pollution, largely driven by vehicle emissions, industrial activity, power generation, and waste burning, and household air pollution, which arises from the use of solid fuels such as wood, charcoal, dung, and coal for cooking and heating. Fine particulate matter, particularly PM2.5, is small enough to penetrate deep into the lungs and enter the bloodstream, triggering systemic inflammation and damaging vital organs. Exposure to air pollution is now recognized as a leading risk factor for cardiovascular disease, responsible for increased rates of heart attacks, strokes, arrhythmias, and heart failure. It also exacerbates asthma, contributes to chronic lung disease, increases the risk of lung cancer, and has been linked to adverse pregnancy outcomes including low birth weight, preterm birth, and stillbirth. The global health burden of air pollution is staggering. Recent analyses estimate that millions of deaths each year are attributable to air pollution exposure, making it one of the top contributors to global mortality. Children are particularly vulnerable, as their lungs and immune systems are still developing. Exposure to polluted air in early life can permanently reduce lung function, increase susceptibility to infections, and impair cognitive development. Older adults face heightened risks due to pre-existing cardiovascular and respiratory conditions. From a healthcare standpoint, peaks in air pollution are consistently associated with spikes in emergency room visits, hospital admissions, and medication use, increasing both acute and long-term healthcare costs. Water, sanitation, and hygiene hazards represent another major pillar of environmental health risk. Access to safe drinking water and adequate sanitation is a fundamental determinant of health, yet billions of people worldwide still lack these basic services. Contaminated water can carry pathogens such as bacteria, viruses, and parasites that cause diarrheal diseases, cholera, typhoid fever, and hepatitis. Poor sanitation and hygiene practices facilitate the spread of these diseases, particularly in densely populated or resource-limited settings. Diarrheal disease remains one of the leading causes of death among children under 5, despite being highly preventable with clean water, sanitation infrastructure, and hygiene education. Beyond infectious diseases, unsafe water can also contain chemical contaminants such as arsenic, fluoride, nitrates, and industrial pollutants. Chronic exposure to these substances is linked to cancers, kidney disease, skeletal fluorosis, endocrine disruption, and developmental problems. Healthcare systems in affected regions often face the dual burden of treating acute infections and managing long-term chronic conditions caused by water contamination. The economic costs include not only medical treatment, but also lost school days, reduced workforce participation, and long-term disability. Chemical hazards in the environment have expanded dramatically over the past century due to industrialization, agricultural intensification, and the widespread use of synthetic substances. Thousands of chemicals are now present in air, water, soil, food, and consumer products. Some of the most concerning include heavy metals like lead and mercury, pesticides, industrial solvents, persistent organic pollutants, and endocrine-disrupting chemicals. These substances can enter the body through inhalation, ingestion, or skin contact, accumulating over time and interfering with normal biological processes. Lead exposure remains a critical global health issue, particularly for children. Even low levels of lead exposure can impair brain development, reduce IQ, and increase the risk of behavioral problems. In adults, lead is associated with hypertension, kidney disease, and cardiovascular events. Pesticide exposure among agricultural workers has been linked to acute poisoning, cancers, reproductive disorders, and neurological disease. Endocrine disruptors can interfere with hormone signaling, affecting fertility, fetal development, metabolism, and immune function. From a healthcare perspective, chemical exposures often result in chronic, complex conditions that require long-term management and place sustained demands on health services. Climate change acts as a powerful risk multiplier, intensifying existing environmental hazards and creating new health threats. Rising global temperatures increase the frequency and severity of heat waves, which are associated with heat exhaustion, heat stroke, dehydration, kidney injury, and increased mortality, particularly among the elderly and people with chronic illnesses. Extreme weather events such as floods, storms, droughts, and wildfires cause direct injuries and deaths, while also disrupting healthcare infrastructure, displacing populations, and contaminating water supplies. Climate change also alters the distribution of disease vectors, such as mosquitoes and ticks, expanding the geographic range of diseases like malaria, dengue, chikungunya, and Lyme disease. Changes in temperature and rainfall affect food production, contributing to food insecurity and malnutrition, which in turn weaken immune systems and increase vulnerability to disease. Mental health impacts are increasingly recognized as communities experience trauma, anxiety, and loss related to climate-related disasters. Healthcare systems must adapt to these evolving risks while simultaneously reducing their own environmental footprint. The burden of environmental hazards is not evenly distributed. Low-income and marginalized communities often face higher exposure to pollution, poorer housing conditions, limited access to clean water, and greater vulnerability to climate impacts. These same communities frequently have less access to quality healthcare, creating a cycle in which environmental risk and health disadvantage reinforce one another. Children, pregnant women, older adults, and people with pre-existing health conditions bear a disproportionate share of the harm. From a global perspective, low- and middle-income countries experience the greatest absolute burden of environmentally related disease, even though many environmental hazards are driven by consumption patterns in wealthier nations. Healthcare systems worldwide feel the impact of environmental hazards through increased patient loads, rising treatment costs, and the need for long-term management of chronic diseases. Hospitals see more admissions for asthma, heart disease, heat-related illness, and infectious diseases linked to environmental conditions. Primary care providers manage chronic respiratory disease, cardiovascular conditions, and developmental disorders associated with environmental exposures. Public health systems must invest in surveillance, prevention, and emergency response while balancing limited resources. The economic implications are profound, as environmental health impacts reduce workforce productivity and increase healthcare spending, diverting funds from other essential services. Addressing environmental hazards requires a shift from a reactive, treatment-focused model of healthcare to a preventive, systems-oriented approach. Prevention offers the greatest health gains and the most cost-effective outcomes. Improving air quality through cleaner energy, sustainable transport, and stricter emission standards can rapidly reduce cardiovascular and respiratory disease. Expanding access to clean cooking technologies can protect women and children from household air pollution. Investing in safe water and sanitation infrastructure prevents infectious diseases and supports child development and economic growth. Stronger chemical regulation, monitoring, and safer alternatives can reduce chronic disease burdens over time. Healthcare systems themselves have a critical role to play. Integrating environmental health into medical and nursing education equips healthcare professionals to recognize, prevent, and manage environmentally related diseases. Environmental exposure histories can become a routine part of clinical assessment. Health facilities can serve as advocates for healthier environments, supporting policies that protect air, water, and climate while also reducing their own emissions and waste. Surveillance systems that link environmental data with health outcomes can provide early warning of emerging risks and guide targeted interventions. At the global level, coordinated action is essential. Organizations such as United Nations, UNICEF, and World Bank play key roles in funding, policy guidance, research, and capacity building. International agreements and frameworks can align environmental protection with health goals, recognizing that protecting ecosystems is inseparable from protecting human health. Evidence increasingly shows that investments in environmental health yield multiple benefits, including reduced healthcare costs, improved productivity, and greater resilience to future crises. Recommendations for action span policy, healthcare practice, community engagement, and individual behavior. Governments should adopt and enforce evidence-based environmental standards, prioritize clean energy and sustainable urban design, and ensure universal access to safe water and sanitation. Healthcare systems should mainstream environmental health into prevention strategies, strengthen surveillance, and prepare for climate-related health impacts. Communities should be empowered with information and resources to reduce local environmental risks. Individuals, while not solely responsible, can contribute through energy choices, waste reduction, and advocacy for healthier environments. In conclusion, environmental hazards represent one of the most significant and preventable threats to global health in the 21st century. They drive a large share of the global disease burden, strain healthcare systems, and deepen health inequities. At the same time, they offer one of the greatest opportunities for prevention and long-term health improvement. By recognizing environmental protection as a core component of healthcare and public health, societies can save millions of lives, reduce healthcare costs, and build a healthier, more resilient future for generations to come.